Hello, everyone. My name is Dr. Yonit Arthur. I'm an audiologist and coach. You are on the Steady Coach. Today, I'm going to be answering one of your questions. And this one comes from Brian, who commented this question on my YouTube channel. Hello, Brian. But Brian is certainly not the first person to ask this question, nor will he be the last. And I'm really looking forward to answering it. The question goes essentially something like this. Hey, Yonit, why is it that when I look on the internet for information about my particular diagnosis, PPPD, MdDS, vestibular migraine, or some other medically unexplained chronic dizziness diagnosis that's essentially just a description of symptoms? Why is it that when I look on the internet for information about this, do I find nothing but reputable, credible medical sources saying things like, this condition is lifelong, chronic, and can only be managed? And in addition, Brian asks, listen, it's pretty obvious that the methods you're talking about on this channel work. And not only that, that recovery from PPPD, MdDS, and vestibular migraine is actually quite common. So, why is it that these medical sources aren't talking about the methods that you talk about on your channel when they so obviously work? Excellent questions. Now, before I get into the answers here, first of all, let me explain how I'm going to structure my answer. We're going to actually first take a look at how these methods are actually being used in various approaches to neural circuit dizziness symptoms and diagnoses. Then we're going to go into some of the maybe the more practical reasons why these methods aren't being more widely adopted by many people in the mainstream medical community. And then we're going to look at more broadly some of the, I think, bigger problems that are leading to resistance to adopting these methods or causing people not to adopt these methods as part of their treatment for neural circuit dizziness conditions. So we've got a lot to cover today. Before I go into any of that, you should know that this video is part of a series called Ask Dr. Yo. It is all unedited videos in which I answer your questions, just like this one. So if you're new to my channel or just have questions, which many of you do, please check out the playlist called Ask Dr. Yo. That's going to be linked in the video description. You can find it by just looking at the video description and clicking the More button. That'll show you all the links and all that stuff. Okay, so first, let's just talk about kind of the lay of the land here. So I just want to start this video by saying what these medical sources are saying, that these symptoms are something that are lifelong and that no one can recover from, is just not true. It is just incorrect. It is false. And I am not just saying that because I regularly see people recover and stay recovered. I'm also saying that because some of the big research groups that actually study things like PPPD specifically say in their white papers published in reputable medical journals that the reversibility of these conditions should be emphasized when working with patients. So I am not the only one in the vestibular world who says that these are not necessarily lifelong conditions that can only be managed. There are researchers who agree with me. This just isn't being translated into clinical practice in many situations. So I I want to say that I am aware that many of you unfortunately received those damaging messages that this is lifelong, chronic, etc. Uh, and of course, that is still the common phrasing, or that's still the common perspective that a lot of medical professionals have on these kinds of symptoms and diagnoses. But that is changing. That is changing, not just because of the what I've seen in the research papers that I've talked about, but also because I'm seeing it changing in clinical practice at very high level institutions with very well trained, knowledgeable neuro-otologists. So I've personally talked to several prominent neuro-otologists at prominent institutions that are sending people to my YouTube channel to learn more about what they can do when they have diagnoses like these neural circuit dizziness diagnoses. Not because they agree with everything that I'm saying, but because I think well-trained neuro-otologists who, again, are familiar with the research and also have a lot of clinical anecdote and clinical experience with patients understand definitively that treatment of these conditions must be biopsychosocial. It cannot just be biomedical. These are not structural disease problems that are leading to people like you having these symptoms. These are central sensitization issues that are physiologic in at their base, meaning there is actually a brain change that is causing people to have sensations like these. But a brain change isn't a permanent thing when it's not associated with tissue damage. In other words, these physicians, I think, recognize that what we're dealing with here is a programming issue that is highly influenced by psychosocial and psychospiritual factors in someone's life. And by treating it only through a biomedical lens via a physical therapy, which I'm totally in favor of, by the way, or medication, which is totally an option to help you with your condition, that is not adequate. That is not enough to help many people recover and be well and stay well. I think this is something I'm starting to see recognized from very, very smart, well trained people in the vestibular world as well. So, now let's talk about why this might still not be the case for many of the physicians that you've seen or medical providers that you've seen, why they're still not adopting these methods. Knowing again that there is benefit to them, it's very clear to see that. Okay, so again, we're going to talk about the more practical reasons why first, and then I'm going to talk about the more big picture reasons. So I have 5 reasons why, like, for practical reasons, physicians may not be using this as part of their practice, or you may not have been exposed to this before you found my YouTube channel. Number 1, I think probably the biggest barrier is that there's really not a lot of good quality evidence for using some of the methods that I'm talking about, like talking about feelings and working on stressors and all that stuff in the vestibular world. That doesn't mean that the evidence isn't overwhelmingly there if you actually talk to people, right? So it requires actually talking to people, listening to their stories to know this. But I'm talking about randomized control trials. I'm talking about papers published in journals where they have groups of people who aren't receiving the treatment and who are receiving the treatment, and they can compare them. We do have studies like this. We, in particular, have some studies on cognitive behavioral therapy in combination with vestibular rehab therapy and SSRIs that shows that adding cognitive behavioral therapy to the mix does improve outcomes, at least in PPPD. But we don't have a ton of research on this. And I think physicians have been trained, of course, to consider evidence when they're making recommendations for patients, and that's overall a good thing. But I think in many cases, this has led medical professionals, and I include myself in that category based on how I thought about things when I was at the beginning of my career, for sure. Medical professionals are often very conservative in terms of what they're willing to entertain as an option if there isn't a good, solid base of randomized control trials or other high quality evidence to base their opinions on. And they become so concerned with the kind of evidence that they need that they're not really looking at the big picture and saying, okay, well, maybe we want the barrier for entry to be really high when we're doing something like giving someone a drug that could have side effects. But maybe the barrier for entry might be a little bit lower in terms of what uncertainty I'm willing to accept when we're talking about something like, hey, you should practice self-compassion or mindfulness, right? So again, but I think that this conservative approach, this I want very high levels of evidence, is just kind of the standard that people assume is necessary, physicians assume is necessary, and this leads them to be so conservative that they won't entertain things that clearly, again, work, but we don't have large randomized control trials on yet. I also want to say that we actually do have a lot of research that these methods help with central sensitization disorders like fibromyalgia, like chronic fatigue syndrome, and many other symptom-based diagnoses. The problem is that, again, when physicians think biomedically, they're looking at the symptom as something that tells us something about the root cause. And that's true if you have, say, a cut on your arm. If you have pain on your arm and you have a cut on your arm, that tells the physician or the medical professional what needs to be done to treat it. So symptoms often tell us about the actual cause that needs to be treated. In the case of neural circuit dizziness or fibromyalgia, the symptoms are are simply the result of which system is being affected, but the root issue is that the brain is overly sensitive to danger, to triggers, and to the symptoms themselves. So the it doesn't take a huge leap to say, hey, if these methods help fibromyalgia or some of these other central sensitization conditions, then we should be absolutely using them for things like PPPD, MdDS, and vestibular migraine. But again, because the symptoms are different and physicians think biomedically, they have a hard time being willing to do that. Okay, so number two, there's a shortage of really well-trained vestibular professionals. I actually have a lot of people show up on my channel because they're amazingly well-trained vestibular therapists are 100% on board with a lot of the things that I'm talking about. And that is awesome, by the way. So shout out to those of you who are vestibular therapists. You're doing incredible work. I'm overjoyed when I hear the stories from people who email me or in the YouTube comments or elsewhere, knowing how much you're helping them by integrating some of this idea that you can't treat the body without treating the mind. You're doing amazing work out there. But that being said, there just simply aren't enough people trained in vestibular disorders to give everyone good treatment and diagnosis. So what ends up happening for many of you is that you'll see more of a generalist medical practitioner who's not super familiar with these disorders, who ends up needing to look them up on the internet or a different website to find out information about them. And then again, they're reading the same things you are. Oh, these are incurable. It's chronic. Maybe try an SSRI. And they're just kind of following those guidelines without having the clinical experience to understand that a biopsychosocial approach, like we talk about on my channel, is going to be more effective. So again, I think the lack of training and just general lack of knowledge is another major barrier here. There are also limitations, number three, in clinical practice in itself. Obviously, at least here in the United States, the way the medical system is structured, your doctor doesn't have a ton of time with you. And it's very impractical to try to implement some of the techniques we talk about, because again, they require sitting down and really talking to people and being willing to say, I don't know a lot, and being willing to really look deeply at what the patient is going through in order to make a diagnosis like this and a treatment plan. And again, this is not a shortcoming in physicians by nature. I think physicians and other medical practitioners are in a system that prevents them from going into the depth that would be necessary to come up with a good diagnostic and treatment process for these disorders. I think number four is important to mention. Medical professionals are very suspicious of methods that not only, again, don't come with a huge pile of evidence behind them that is very specific to the symptoms we're talking about, but also that come with kind of a wild, wild west sort of environment, like in the neuroplastic treatment world. There is as you've probably seen, a huge range of skills and education level and people who are helping people with neuroplastic disorders. And there are a lot of people charging a lot of money for things like supplements and devices and other things, again, that aren't backed by research, which again, I'm open about. And I think I have some very good reasons for believing the things that I do. Of course, the evidence that I see from clients, and also there is actually research supporting what I'm doing, but they see that this is kind of a wild, wild west sort of environment. And I think that puts them off. They're afraid to refer patients to something where patients could potentially be ripped off, or they could work with someone who doesn't know what they're doing and they just spent a lot of money and things be made worse. Again, I am coming from the perspective here as someone who went into a medical profession to help people, that the vast majority of medical professionals go into this stuff to help people They really, really want to help, and they really don't want to harm. And so it's a natural knee-jerk reaction, like, oh, neuroplastic brain retraining type stuff, for physicians to be like, well, hang on a second, like, is this actually something that is going to actually help someone, or is this just going to rip off my patient? And then finally, number 5, practical reason. I think many people really do just want a quick fix or a pill, and they're putting pressure on their doctors to get that. They're like, okay, I have dizziness, so like none of this emotion stuff. Send me to physical therapy, give me pills, fix this for me. And unfortunately, as you know, if you're not new to my channel, this stuff takes some work to recover from. There's a lot of looking deeply, and uh, I mean, even just the graded exposure itself can be really challenging, and then trying to react to symptoms in a new way. And it's a lot to navigate. And I think some people are just not interested in doing it. And patients know that. Little anecdote: my dad is a physician, and he doesn't work in vestibular science. He works in a different field, physical medicine. He sees people with chronic pain, and he knows a lot of the things that I know. And he works in an environment where patients are just not interested in hearing about it. They don't want to hear about the mind body connection. They want medical treatment. They want to get something that will fix them, and they're not open to it. So I think his experience is not unique, and lots of physicians who are otherwise very open to the things that I'm talking about on my channel are afraid to bring it up because they're afraid that patients are going to reject it, or say things like, you're telling me it's all in my head, and get angry. Okay. All right. So those are the practical reasons. Now I have 4 deeper issues that I think are preventing people from adopting these methods more widely. The number 1 reason, of course, is the dominance of the biomedical and materialist way of thinking about disease. In Western culture, that is how we think about disease. And that means that medical professionals are just going to fail to recognize the importance of psychosocial and psychospiritual causes because they are trained to look for biomedical problems. And this is excellent news if you have an acute injury. If you break your leg or you have a bullet in your arm, that is exactly the perspective you want. But when you have chronic symptoms that don't seem to have a real cause, or did have a real physical root cause, like those of you whose symptoms started with vestibular neuritis or BPPV, or maybe a neck injury, and then it progresses into chronic symptoms, having a biomedical lens limits what you're able to see. You've got blinders on. You're not looking at the whole picture at all. And furthermore, this means that research and clinical practice is always focused on looking for the biological mechanism behind someone's symptoms. And then falsely, they attribute cause to the mechanism. So for those of you to whom that was very unclear, let me explain. Mechanism is like describing the biological things that are happening when someone has symptoms. So for example, with PPPD, we know there are changes in how the brain processes sensory information. And you can even see this on MRI, which is completely unsurprising, or fMRI rather. And this is completely unsurprising because if you're dizzy, then obviously your brain is not processing sensory information the way that it ought to, right? Unless you actually have a physical sensory problem, of course. Let me amend that. Or with MdDS, one of the main theories about why MdDS happens right now is there's an issue with the velocity storage system, which again is a neural circuit in the brain. And a lot of the research is focused on these things and targeting these things therapeutically through biological means, which I'm all for, by the way. I never want to deny someone the option to take a pill and get rid of symptoms. If that were possible right now, I would be the first person to tell you about it on my channel. I just want you to feel well. But the problem with looking at everything through a mechanistic lens like this is that you start to focus on that as the cause, and you miss what the actual cause is. And for many people, the actual cause isn't the brain circuit. That's what's leading to the symptoms. That's the cause, the immediate cause of symptoms, yes. But why is that brain circuit even there? Why has the brain not adapted to this particular situation? Why has the brain not adapted to triggers? the answer is obvious, and it's in the psychosocial or psychospiritual realm, not in the biological realm. So when you're focused on a biomedical answer for everything and mechanism for everything, you're not necessarily looking for the actual root problem, and you're not addressing the root problem. And furthermore, you tend to do things like dismiss the nocebo and the placebo. And what ends up happening there is physicians think they're doing no harm by telling you this can't be cured. And if you know anything about how the mind and brain and body are connected, you'll know that that actually does a lot of harm. You're implanting that belief in someone and profoundly affecting them at a biological level. By the way, this isn't just like, oh, it's affecting your aura. This is affecting you on a biological level and actually prevents people from recovering. Again, all of this happens because of the biomedical focus of Western medicine. That was just number one. I know, but that was the most important one. Number two, there's a liability focus in medicine, especially here in the United States, but I imagine this is to an extent everywhere. Doctors, again, want to make sure they're not doing harm, but because they're so conservatively trying to not do harm, they're also constantly covering their butts, so to speak. And that means that they're very afraid to see things that could be misinterpreted and then be held against them in some kind of malpractice suit. So doctors will often stick to protocols even when they know there's an option to do something different because of liability issues. And I think number three, as I said before, people go into this line of work to help people. I firmly believe that. I stand by that. But I also think that the medical system cultivates a certain arrogance in all of us as medical practitioners, as healthcare practitioners, to not be open to to new ways of doing things, and to believe that because things are being done the way that they're being done now, and this is what we learned, and this is what people are doing, that that's correct. And again, this causes medical practitioners to dismiss, again, that idea that the things that they're telling people actually could be harmful. And we have so many examples of times when medicine got it wrong. I mean, the germ theory of disease, let's start there. There have been so many times when medicine, the biomedical model, has gotten it wrong. A little bit of humility would help all of us very much. And that's how I ended up here, because I saw I saw it wasn't working, and it caused a crisis for me. It was very unpleasant, but I think some people just aren't willing to put themselves in that state of cognitive dissonance and accept that maybe there's something that is wrong about how they're thinking about things. Finally, number four, I just said, I showed up 5 fingers and I meant 4. That's how well my brain's working today. So number 4 is there are perverse incentives. Obviously, research funding, of course, is going to be for things that target biological causes because those are scalable and profitable. And again, I don't think there's any single bad person. Maybe there are, but I don't think of it this way. I don't think that there's a single bad actor or evil person who's behind all of this. But I think the system is set up in such a way that this is the incentive. The incentive in our system is to make money and to find biological things that we can produce as pills, and then we can send them out to millions of people. The things that I talk about on my channel are not profitable. They're not easily scalable. They require sitting down and talking to a person. They require human connection. They cannot be put into a pill. They cannot be marketed in that way. And I think that, again, this is one of the reasons you haven't heard about it, because it's simple, cheap stuff that requires a lot of human connection. So those are my thoughts on this. Brian, this was probably a lot more than you asked for, but I hope it was helpful. My final words to you here. The reason the tide is changing is because of you. I said at the beginning of this video, the tide is changing, and it's because of people who have done the things that I'm talking about on my channel and then been brave enough to go back to their doctors and say, this helped me. I have more information for you. Check out this video, check out this book, listen to this interview, whatever. This is how the tide is changing. It's because all of these neuro-otologists that I've gotten to know and who now send people to my work quite regularly, they found out about me through patients of theirs who got better. And they said, "Oh my gosh, you recovered. How'd you do it?" And they said, "Oh, I did the free course or whatever." This this is in your hands. I can put out this information, but it's your job to get it into your doctor's hands as much as you can. I'm working on that too. I'm working on an entire course specifically for doctors, nurses, physical therapists, other medical professionals, so that's basically just an in-depth course on how to diagnose and treat neural circuit dizziness disorders. I'm working on that now. But really the change is happening from you. And I'm so, so grateful to you all for doing that, because my message is only effective when it gets in the hands of the people who are suffering and in the hands of the people who are helping the people who are suffering. So it means a lot to me personally, but also know that the power is yours to continue to make this change. Okay. Well, everyone, I'm looking forward to hearing your comments and questions about this one. No controversy in this video at all. Oh, goodness, no. Please leave questions and comments below. And of course, you can also like the video, share it, and subscribe to my channel if you're on YouTube. Some of you may be listening to this as a podcast. I would love it if you could subscribe or follow the podcast. Leave us a 5-star rating if you think we deserve it. These things also really, really help me reach more people, which, as we just talked about, is kind of the point of the whole thing. Okay, so everyone, take care. I will talk to you soon.